Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Thank you for joining us tonight, and we are going to continue the tradition of having a very enlightening show. Hopefully, you were able to join us last week as we discussed COVID as relates to the children in our lives. Tonight, we are joined by a distinguished panel of guests who will talk about maintaining mental and physical health during a pandemic. We all know that this pandemic has brought about so many emotions and anxiety amongst so many of us. So we thought that tonight's panelists could enlighten us, share some of their insight, and really talk about what's, as we say, what's really going on. So tonight I'd like to start by introducing Dr. Josie McLeod. Dr. McLeod has worked in urgent care, occupational medicine, and community care. She is currently working as the medical director for Ascension St. Vincent's and sees patients in the transitional care and at St. Pius Primary Care Clinics. Dr. McLeod, how are you this evening?
Hello, I am well. Thank you for asking. Very happy to be here and discuss this very important topic. Thank you for the invitation.
Thank you, Dr. McLeod, and welcome again. We really appreciate you being with us tonight. I'd also like to introduce to you Dr. Vincy Samuel. Dr. Samuel is the Director of Employee Health at Baptist Health and has been the System Director of Employee Health since 2015 after beginning her career at Baptist Health in 2013 as a clinical epidemiologist. Dr. Samuel, how are you this evening?
I'm doing great. Thank you. And very excited to be here as well.
Thank you so much and welcome again. Next, I'd like to introduce Nana Tahil. She's a biopsychotherapist and personal life coach. For over 35 years, Ms. Tahil dedicated her career to empowering and improving lives of those faced with life challenges and transitions. Ms. Tahil, how are you this evening?
I am very well. Thank you very much for inviting me to the show. Thank you.
You're very welcome and welcome. And last but not least, we have joining us, and I was teasing with him earlier, all the way from California, Mr. Vincent Blair, licensed marriage and family therapist and president of Alpha Behavioral Counseling Center and founder and president of Omega Mental Health. Mr. Blair, how are you this evening?
I'm very well. Thank you, and I appreciate being invited to the show.
Wonderful, wonderful. Welcome. And so tonight, Dr. Kane and I are going to ask our distinguished panel several questions, and hopefully, you will gain some insight to help you make life a little less stressful. And also, that you will not only keep that information within you, but you will pay it forward. And you would do us so much help if you would share the Pause for the Truth podcast with your friends. The more people who join us, the more we're able to broadcast the show widely. So, Dr. Kane, are you ready to begin the questions with our panelists?
Yes, I am.
Okay, how about I start it
I'll
off?
let you start. There you go.
Thank
you
you.
start.
Thank you. And I'd like to ask each one of the panelists, and we'll go in the order that I introduce you. So, Dr. McLeod, we'll start with you. Please share how you have been personally and professionally impacted by the pandemic.
Well, that is a big question. Personally, I have had some family members and some friends that have tested positive. Most have done very well and had only minor symptoms, but I have had some losses due to COVID personally, and I've also had some patients who have had some serious losses and some friends who have had some serious losses. So it's been a very trying time, I'll say, very stressful. Um, it's a lot. I could say a lot about that to answer that question, but it's been just in general a very stressful. Getting kind of what I call COVID fatigue, and that's just fatigue from just dealing with it in general. You have, having to ask every single patient the same questions to make sure that they haven't been exposed, to make sure you haven't been exposed to them. Um, Whenever a patient calls or comes in with one concern, you got to make sure it's not related to COVID. So um, I've been pretty impacted. I've tested way more times than I like, but I still have to continue to do that just to make sure that I'm staying safe, keeping my family safe, keeping my patients safe. So.
Thank you. Thank you, Dr. McLeod. What about you, Dr. Samuel? How have you been personally and professionally impacted by the pandemic?
So, personally, it has certainly been challenging to be separated from family and friends and navigate a new normal of limited social activities, vacations, those things that you love to do with your family and your friends. And then there's the constant worry of your loved ones getting sick and what you would do in that type of a situation. So, I'm sure, just like everybody else, personally, it's been a very trying time. Professionally, it's been a very long year and a half of late nights, early mornings, limited sleep in between. And it's been really hard to watch how much people and the employees of my organization have been going through, as well as people within our community, whether it's because they themselves got sick, whether it's because they are caring for people that got sick, or because in a healthcare organization that they're here working extra for our sick patients and trying to ensure that their patients are okay, and sometimes maybe not taking care of themselves as much as they should be. Having said that, professionally, it's also very rewarding to be able to provide care to people, and certainly passionate about what I do every day, regardless of the impact that comes with it.
Thank you, Dr. Samuel. And I know you've been pretty busy because I've seen you on numerous interviews on television as a spokesperson for Baptist Health. So thank you for the work that you have been doing. Ms. Tahil, what about you? How have you been personally and professionally impacted by the pandemic?
Well, I think for me, there have been, like for all of us, I have been impacted both, I guess, negatively and positively. So, we talked about friends, family members who have been sick. Some of us have lost friends and family. And we talk about the isolation and the mental health impact. And as a mental health provider, I have seen that personally. I have to say that last year, I was working as a mental health counselor and evaluator in an emergency room here in Jacksonville. And I had to take pause and reevaluate my values really and figure out what is most important to me. And as a result, I decided for my family and myself, it was best to work in a different environment. And I think it is, for many of us, we have built our resilience and we have learned a lot of lessons. I would say that one of the biggest lessons I've learned is that I'm a stronger person than I thought I was. Plus, I've always been somewhat techno challenged. And I believe that with the COVID pandemic, we have increased access to mental health. So telemental health, telebehavioral health was not as common prior to the pandemic, but it's more widespread and acceptable now. So I feel that that is huge in terms of providing mental health care to those who need that.
Yeah, that's a pretty bold statement that you made, Mr. Hill, that you had to reevaluate your own life for your safety as well as the safety of your family and change. So that's thank you for your transparency. I appreciate that. Mr. Blair, how about you? How have you been personally and professionally impacted by the pandemic?
Um, it's pretty much what everyone is saying. I mean, it sounds pretty universal. The impact was kind of sudden. I don't, in the state of California, basically one day our office was full. It was full of clients, and all of our staff was there. And then we got a notice to shut everything down. So we had to quickly kind of transition from face to face to going into telehealth. Um, some of our clients were really resistant to that. They didn't know how serious this was. They wanted to to postpone their mental health treatment to wait for the pandemic to end. Like I said in the beginning, nobody knew how long this was going to be. But slowly they've kind of come around to that. And I think with the telehealth, that's made it a lot easier to connect with some of our clients, especially those clients who had difficulty making it in or um, coming into sessions or transportation and things like that, or even the ones that suffered from like really anxiety and depression that couldn't physically come in, and now they're getting the help that they need because they're able to log in. So that's kind of been a positive on that end of it. Um, then the negative has been that there's a lot of people who are are becoming infected or have been infected. I haven't had anyone who's very close to me that's died or passed away from it, but I've had several friends who have had close calls with it and been infected by it. We have staff members who continue to get infected by it, even though they're really not coming into the office. It's just their family environment or just the environment that they're in that they come into contact with it. So it's a daily struggle to kind of uh, to try to work and make sure everybody's safe. I know that was kind
Yeah.
of winded, but
Yeah, thank you. I can just, you almost hear it in folks' voices, and the television, the national news media has done a fairly decent job with highlighting stories of not only healthcare workers, but, others who have had to work throughout the pandemic. So, to only imagine how you all have had to balance your personal and your professional life. Dr. McLeod, I want to ask you, have you noticed that people aren't managing pre-existing conditions like hypertension and diabetes because of the stress of the pandemic? If so, how have you addressed that?
Yes, I have had some of that. The majority of the patients are pretty much still doing what they normally do, which unfortunately is not managing well anyway. But I have had some patients who have been afraid to come into the office because of the pandemic, and they're afraid to go to specialty appointments and anything that has to do with the hospital. Um, and, some of it is just because of worry about catching, COVID or being exposed. And some of it actually is from patients who just don't, feel like answering the questions all the time. So what we've done is we make sure to offer virtual appointments. We do everything we can, especially with the elderly patients, to walk them through that. We use our telephones. We ask them to get grandkids to assist them with the virtual visit, and just try to encourage them to kind of, sometimes you have to just kind of stop watching the news and watching all the negative press about it, because I have had some patients who actually never had any problems with anxiety or depression, and just from watching and listening all the time have started to become more afraid. So that affects their blood pressure and their diabetes because they may not want to go out to get their medications. And again, they don't want to come in for their appointments. So, virtual is limited. You can't check blood pressure. You can't check their blood sugar over the phone.
Yeah.
So,
Yeah.
But and Jocelyn, before you move on to the next, what we any further, what I would like to ask, because I wanted to segment on Mr. Blair's conversation about the addressing the older patients in terms of their appointments, as well as Dr. McLeod, who just mentioned it. What would you? How do you usually address loneliness and isolation in an older population, especially since they were the ones who initially really took this thing serious, isolated themselves, did all the things we asked them to do in terms of how to prevent spread of it, and they were very serious about it. But as a result, I've seen some patients that have demonstrated a complaint about being lonely, and isolated from their family. It begin to get next to them. Can anybody comment on that?
yeah, we encourage them to, use technology, get their family to help them with that so they can FaceTime or have Zoom family meetings. We encourage, something that's done consistently. There are some offices that I'm in that we have case management, so we do reach out to them to find out if there are any, virtual opportunities for them. It's very tough. So I'm definitely open to hearing about any other suggestions that anyone else has. But yeah, we've mainly been trying to use technology, and we actually do call our patients and check up on them as well, just to encourage.
So, Mr. Blair, you mentioned it initially. What do you do, and how do you handle that situation in your practice?
Yeah, I was muted. I didn't catch myself. I agree with the doctor that getting our older patients or clients, we refer to them as clients, to reach out to their children, their grandchildren, and to connect with them more. And I've even gone so far as to all of us have little hobbies and things that we used to do or we used to have fun doing that you can kind of almost do by yourself. That get back involved with some of the hobbies that you have. If it's I don't want to sound dated, but if you're into quilting or something, maybe pick that back up again. I personally, I got a fish tank and I mess around with my fish, or I have a telescope. I go out in the backyard and try to find planets. And so some of those things that was enjoyable to them, maybe pick those things back up, or try to pick up new hobbies, or learn different skills, or just use that time to explore new things. So that's kind of some of the things that we talk about.
Yeah, my wife does a lot of puzzles. I've seen more puzzles in my house. You got these 1,000-piece, 2,000-piece puzzles that I only walk up every now and then and put one piece in. Jocelyn, you wanted to proceed and ask about some of the other stress-related alerts to work.
Well, no, I really wanted to comment real quickly before we move on. When Dr. McLeod was talking about helping elderly patients with doing telehealth, I laughed because I had to do the same thing with my own mother, and really helping her to navigate that. And quite frankly, she still hadn't got it, or either she's just wanting me to help her every time she does her telehealth appointment. So just wanted to laugh about that. Yeah, I would like to ask though, what are some tips to manage and cope with job stress during the COVID-19 pandemic? And Dr. Samuel, I think I want to address that one to you. Tips to manage and cope with job stress during the COVID-19 pandemic.
That is a great question. One of the things that we certainly recommend, and I'm sure this goes across the board, is, making some time for yourself, whether it's, a hobby or exercise. It's been difficult to be indoors during this pandemic, but even just taking a walk and getting that fresh air, to take a break. And a lot of our workers, they don't have a lot of extra time on their hands, but even that 10 minutes taking that break to do that can certainly be beneficial. We all need connections with other people. And so even as we have to quarantine in certain situations, or at work we have to social distance, being able to still connect with people, whether it's through a virtual format with our family and friends, or if we are at work, that even though we might be social distancing, that we still get to talk and share and be able to trust each other. Just know that other people care about us and know how we're feeling, on any given day, be able to support each other in that way.
Have you found that people really don't know who to talk to, or do you all have any suggestions of who folks should talk to about work stress?
I can talk specifically in our organization that we do refer people to mental health providers. And I know we have some great mental health experts on the call today that can probably tell people where they should go. But we certainly do recommend, if someone needs someone to talk to, that we can help refer them to a mental health provider. It's great to recognize those signs early and to be able to talk to someone sooner than before they get to a point of either being burnt out on the job or, in a place of stress and anxiety and depression, whatever else, when it gets to that point. So certainly recognizing those signs early and reaching out to a mental health provider, it would be recommended.
Yet I don't know why, Dr. Samuel, when you were talking, and I can tell you that I'm not speaking for myself, but just thinking out loud when you and I'd like for someone else to chime in, but I'd like to add this part of it into the discussion. Have you noticed folks are taking up other bad habits? Like, we talked about maybe doing puzzles, or some may even be fishing, or whatever the case may be. But how have you noticed people drinking more, or talking about they're consuming more wine or whatever other adult beverage since the pandemic? Anybody?
I hear that more from a comical standpoint of, what this is all doing to them. I don't know for certain how that's affecting them in a serious way in their personal life outside of work.
Okay, thank you. Anybody else
They
want
may
to
not
chime in
mess
on
up
that?
anyway.
Yeah, that's true.
Seeing an increase.
Yeah, I can't speak for, I don't want to speak for employees, but I do know that there's been a big uptake in domestic violence since the pandemic started. And generally what's happening is because people have to shelter in place. If you have a batterer that's in your home, before the pandemic, you could get some relief by leaving or not being around that person. But now that they're in your home, that's where they're coming into closer contact, and that's been happening more frequently.
Yeah.
So we're trying to do things to empower themselves and reach out for help where they need it, and recognize when this is starting to happen, or when their significant others or family members start to change, and I've noticed that's happened quite a bit.
What about children and the stress of the pandemic? Are there particular behavior changes that parents or grandparents should be looking for?
I would say if they start isolating, closing themselves off, that's a real big signal that something's going on with them. But the flip side of it is that children seem to be a little bit more resilient than adults are with this. They seem to kind of take some of this stuff into stride, and they're handling somewhat better than I think some adults are. We are noticing now that the kids are coming back to school, and now there's a threat that the schools may shut down again. There's a lot of anxiety with kids because they don't want to miss another school year. They want to see friends. They want to play with their friends. So that's another dynamic that hopefully this doesn't happen.
So what should parents or grandparents or caregivers do to help support their children in times of stress?
I think normalize how they feel. I think we spend a lot of time telling our children that everything is going to be okay. Oh, don't worry about this. And I think that maybe you need to sit down and have a serious, an open conversation with them and normalize what they feel and what they think, and not minimize that.
Mm-hmm. Mm-hmm.
Someone
Anybody
else
else?
was about to comment. Yeah.
So this is Nana, and I would like to just chime in. I think one of the very most important things that we can do for ourselves and also for the kids and also our parents, etc., is to really teach self-compassion. I think a lot of us, we feel that, especially those of us who are in the helping profession, whether physical or mental health type profession, we feel that we have to be the caregivers and the heroes. And unfortunately, sometimes we're so much into our roles that we forget that we too need care. And it's okay not to feel okay. It's okay to get stressed out or burnt out. And I think key is to find that help, whether if you're working through the EAP services or other organizations that can lead you directly to either group or individual type help.
Yeah, and that's you raised a good point. That's so true. Thank you. Anybody else like to chime in on that? Otherwise, we'll move on to the next question. And really, Mr. Blair, my next question was going to be about added stress on couples working remotely, and you've said that in terms of those persons who may have been dealing with domestic abuse issues, but just in general, have you all noticed added stress on couples while they've been working remotely? And I know a lot of folks have gone back to work, but some folks are still working from home.
Mr. Blair.
Anybody?
Okay, no, he's got it.
Yeah, can you repeat that?
Yeah, I was asking, have you noticed, you talked about a few moments ago that for folks who may be working from home, they've been around their spouse more, and therefore those persons, unfortunately, who are dealing with domestic violence issues. But just in general, have you noticed added stress on couples while they've been working remotely?
Um, that's kind of I guess a 50-50 question. I think one of the doctors mentioned that some of them, when they talk about drinking, it's kind of joking, and I think sometimes I do hear people talking in general about how difficult it is to work at home with their significant other or their spouse or what have you. But I haven't heard that specifically.
Okay, thank you.
Anyone else?
So, yes, this is Nana, and I was reading some statistics, and in my practice, I have noticed this as well. I have seen an increased number of couples with relationship issues. And I think overall, the statistics show that at least 20%, there has been at least a 20% or more increase in alcohol and substance use disorders since the pandemic. And I think that for some, if you're home and you're trying to, if you're bored, then sometimes you overdrink, right? And that, unfortunately, is one of the negative coping mechanisms. I would say what I have noticed is especially women and women who work at home, they seem to have a higher rate of anxiety because of the roles that they play as mothers, especially those who have like really younger kids. So if they have to stay at home and they might be working remotely, they have a lot of conflict because the kids think that mom's home. And so there's this guilt of not taking care of the children and having to do whatever needs to be done at work. So there's the boundary issues that come in, and the guilt and anxiety of not being able to perform as well for work.
But I think it was, I don't know which one of you said, though, you have to be honest with children and really take them where they are. I know we were talking about in terms of acknowledging their feelings, but you just have to be honest with them and explain to them that although they're at home, they're working as if they were working outside of the house, and to establish those boundaries with them. But on the flip side, I just wanted to, before I move on, let Dr. Kane move forward with the next question. I wanted to jokingly say that the comedians sure made a lot of jokes throughout and talked about how some couples realized they didn't like one another because they were working they were around one another so much at home and had never been around each other consistently that much until the pandemic. So I know it's not a joking matter, but I noticed the comedians on TV made a lot of jokes around that, and I don't know if that's something that any of you have had to have conversations with any of your patients maybe about.
Anybody want to speak to that, or we can
move on?
Yeah, we can move on. Well, one of the things, and I'm going to turn the corner just a little bit, but still regarding the stress of at work. One of the me, being employed as a primary care physician, or actually working for myself, I want to know, what is the impact of COVID on the mental health of healthcare workers, and in particular, you see how stressed they are and on the various situation. Worst case look like it's being in the hospital, those tertiary institutions, but still, you also have, even in my private practice, we're experiencing that. How do you can chime in on this? But how would you help them cope with the mental stress and the some may have depression or whatever it may be? How would you help them cope with that anxiety and stress that working under those circumstances, under these circumstances that COVID pandemic has presented to us?
Hi, this is Vincy. I could start off with a few things that we've done in our healthcare organization. And so one of the things, and this is just thinking about while employees are actually at work, how do you even give them that break when they're at work? We have had some refresh areas where people can take a break, listen to soothing music. They do have a really hard, long shift that they have to work, and being able to allow them to step away for just a moment to get a little bit of reprieve is helpful. We offer spiritual care, and so if they need somebody to talk to, or mental health providers, those are both options for them. We've increased the number of our EAP visits, and so if they need more visits to see a mental health provider, that opportunity is there. And then we also round with treats and coffee breaks, and just try to be present with the team, and so that at least while they're here in the middle of their shift, we can provide some support, let them know that we're right there next to them.
Anyone else?
Well, some of
That's
the things that I do, I just kind of give myself a timeout. I make sure that I actually take time for a lunch break. No matter what is going on, it can be put on hold. And when I go to lunch, I try to make sure that I walk outside to either go to lunch or to come back, just so that I can get some sunlight, some fresh air, and a time to kind of unwind. If under some circumstance I cannot make it outside, I will literally sit at my desk and close my eyes and just take a little mini mental break, pretend I am in Hawaii or anywhere that's not there. And I play music in my office. I just kind of, meditate. Sometimes I will pray right before I go into a patient's room, just depending on who the patient is. Just those kind of things, just to kind of give my own self a break. Yeah, some of the patients, you're going to be tested, so you got to say an extra prayer first.
That was even before the pandemic.
Yes, but I'm doing a lot more of that now.
Well, listen, what I do want to do, though, let me ask this question. So what would we look for, Dr. McLeod, and anyone else that want to tune in particular, Dr. Samuels, you may have something that the hospital is doing. What do we look for, and what are some of the signs we should look out for when we looking for the professional to protect, myself as a worker from the mental stress of COVID? So what are the signs and symptoms that we should be looking at the other employees and to help them to note that they need some help toward dealing with COVID?
If I could just say, I think one of the telltale signs is if you start seeing in either yourself or someone else signs of compassion fatigue or burnout, then that's a conversation probably needs to be had when you have people just totally just tired mentally and physically, and there is no care for the patient. And I think work performance is being compromised. So I think that's a big telltale sign.
And let me expand just a little bit further. What about any staffing issues? Dr. Blair, you're in private practice. I don't know if you've had an issue with, but what about staffing issues that you've, as an employer, you've encountered as a result of the pandemic?
For our office, our clinicians are pretty much working remote. The only ones that come into the office right now are the office staff. So it's generally 4 to 5 office staff in each office on a daily basis. But I have noticed that you start to see little trends. Like you have some that you notice, like every Monday or every other Monday, they call in sick. Or you notice that, it's almost like they're taking turns calling in sick. So you kind of notice that that's a change. And then that's the time when you kind of really need to start sitting down and having those conversations and checking in with them to see how they're doing and what's going on with them. And give them the freedom to speak to you, freely and casually or openly about how they feel. I think a lot of times they look at their superiors as, I don't want to tell them. I don't want them to feel like I'm weak. So we just try to be we do a lot of checking in. We ask them how they're feeling. We just try to make sure that it's an open door policy for them to talk to us about how they're feeling.
Ms. Samuel, I'm not sure, how free you feel to discuss this matter, but you did allude to some of the things that the hospitals were doing to make your workplace easier, safer, or however you would like to phrase it. Can you speak to that as well?
Sure. And I'll piggyback a little bit with what was just said. I do think it starts off with some open communication and having your employees trust you to be able to share information with you about how you're feeling and, what they think they might need to provide a better environment while they are here. That does help in the retention aspect of it. And then from there, just because of the nature of how COVID has run through our community, obviously we've had employees that have had to be out sick and had to recuperate or care for loved ones. And so then there's the part of constantly recruiting and hiring more employees or travelers to help supplement this staffing that we need to then care for our patients. So there's kind of a balance between, taking care of our employees and then also ensuring that we've got the right staffing model in place to account for, the unexpected.
Okay. And I can attest to that. I'm having difficulty just hiring finding two new employees. But I digress. Anybody else want to address that within their work environment? So what if an employee refuses to come to work out of fear of infection with COVID? It may be a little bit of a touchy subject, but anybody feels comfortable addressing that?
I'll talk about it from a very generic standpoint. Obviously, there's probably going to need to be some involvement from the legal team of that employer. And then I think there's just some general things that may need to be addressed as to whether are they just scared in general, or is there a true valid concern? And then based on if there is a valid concern, are there any opportunities for accommodation, whether it be through remote work, and not all job roles can be done remotely, but is that an option for that particular job role? Or is there a leave of absence opportunity if they feel like they can't be in that workplace? Is there an opportunity for them to take a leave of absence until they are ready to come back? So there just may need to be, again, that open communication, helping with any misinformation and education to help that person in a healthcare setting. We do a lot of conversations about PPE, and a part of taking care of patients, we're providing you with all the PPE you could possibly need to help protect yourself. And so just really understanding where that fear is coming from and what that refusal is probably the first step, and then identifying where you go from there.
With PPE being personal protection equipment that you need to prevent contracting the virus is what you're referring to, right?
Correct.
Okay. Just want to be sure our audience understood. Then you kind of alluded to some of how the large and small business can support, staff's mental health during the COVID-19 pandemic. But the only thing I would like to know is, from the standpoint of counseling with a person who refuses to go to work, one of your can either Mr. Blair or Ms. Tahil, can either one of you guys address that, or even Dr. McLeod as well? Any counseling related?
Can you repeat the question, Dr. Kane?
Okay, so what counseling can you provide to those people who refuse to come to, the employee that refused to come to work out of fear of infection? How do you, with the fear of infection with the virus, what is it that you tell, or how would one counsel those employees exhibiting those fears?
Well, I just educate them the same way I educate my patients on the actual virus and how to protect yourself from it. I encourage them to get vaccinated, use the techniques that they were taught, hand washing and cleaning the rooms and everything after each patient. And to me, that just kind of reinforces the rules we have set forth by OSHA anyway, which are to keep the lobbies clean, keep the patients socially distanced. To me, that really just makes them more aware and more willing to go ahead and follow the rules that were set forth, because that was a problem that we had in one of my offices, where they weren't as serious about making sure that we had social distancing, roped off certain chairs, had patients wait in their cars if they had symptoms. So I just reinforce that and let them know that this is for their protection and their safety, just as well as it is for the patient. So I think with education, you don't have that problem as much. I haven't seen that at all. I've seen quite the opposite, where they're not as serious about it and not taking the precautions that are needed to keep everyone safe.
Yeah. And I'm glad you said
so.
That. I'm sorry. I'm glad.
No, go ahead, Mr. Blair.
No, I said I'm glad you said that, because I was a little apprehensive to chime in because I kind of see the opposite of where we're having to make sure that we remind them to wear their mask, wear your gloves, use a sanitizer. That was a day-to-day thing for a long time to get them into the habit of really taking care of themselves. Because as they said in the beginning, I don't think people knew how serious this was. I think they really thought it was something like the flu. And so they weren't really taking care of themselves. And even now that it's been on for a year now, you can still see that if you're not diligent about it, they will get lax and not take the precautions that they need.
All right. So we do have a caller or a question from the audience. Can you, Jocelyn, do you see that question? I'm sorry, I can't bring it up on mine.
No, I
I
sure
think it's
don't.
from Higher Ground. I think he's on the line from Higher Ground.
Yes.
Go ahead, Higher Ground.
How you doing?
Fine. How's it going?
Excuse me. I started choking here all of a sudden when it's time for me to speak. So, excuse me. No, I just wanted to add to what the young lady was saying about, actually, what Dr. King, you were saying if someone doesn't want to come to work. I actually have a couple of friends that actually work at car dealerships, and she actually has taken her second leave, and I think I don't know the exact initials, I think it's FMLA, something to that effect, that you're
Family
actually
medical leave.
allowed to leave your job for, I believe it's 12 weeks at a time, and then you have to get some kind of doctor's note. So there are some provisions by the state of Florida that is protecting people who are have some concerns about going to the workplace during the COVID.
Thank you.
Okay.
Yeah.
Thank you. Yeah, you're talking about FMLA. I want to switch the gears a little bit, and if you would, thank you, Higher Ground, for joining us on the show. I'd like to switch gears for just a bit, and Dr. Samuel, I am going to come back to you because I want to know about the employee benefits as far as what people are taking advantage of. But before I get to that, I want to ask about any conflicts at any of your practices, or have you heard any of your patients say that there have been conflicts of people who are vaccinated versus the unvaccinated, and how's that going? You know, the fear and anxiety that goes along with that, or just downright anger that people may have of going to work. They've done their due diligence and gotten vaccinated, but they're going to work knowing that some of their coworkers are very adamant about not getting vaccinated. Anybody had to deal with that?
I'll just say that we do have both sides of that, the anger on both sides, the concerns about getting a vaccine that they think is still experimental and being asked to take that vaccine. And then you do have the other side of it where they did do everything they possibly could do and got vaccinated. And yet people around them, the patients even, are coming in. And most of our patients that are hospitalized are unvaccinated. And so that feeling goes both ways. And the number one thing we do try to do is the communication and education. So having that open ear for why are you concerned? And we have provided experts from infectious disease that opportunity to possibly help dispel some of that misinformation or help them guide them into a direction that would be appropriate for them.
That's good. That's great. That's fantastic, because I can only imagine how folks might feel who have been vaccinated in going to work and having that anxiety. Thank you, Dr. Samuel. And we are nearing the end, and we have a few good questions left that we want to ask. Dr. Kane, I'll let you take the next one.
I really want to ask this one. So how about intra-family discussions regarding vaccine hesitancy? For instance, husband and wife, or children and parents, or children and grandparents. For example, I have a family that's in a multi-generational household whereby the grandparents are the daycare providers for the very young, live-in grandkids. age less than 12. And the grandparents, being at high risk of mortality, are both vaccinated. But the son, who is the custodial parent, refuses to get vaccinated, even though he lives with his parents. Anybody has any thoughts on that, and how would you address that? Nobody jump right into it. I know it's
Well, I may not be the best person to answer this because I'm really straightforward with my patients, and I would probably ask them, how they would feel if something happened to their parents that was a direct result of something they did, So again, educate on the importance and why. I think a lot of people have a lot of misconceptions about the virus and the vaccine. So, I will go so far as to send them podcasts such as the ones we've been doing, and other providers who have been giving a lot of good information in a way that the general public can understand it. But I take the time with those patients as much as I can, or those family members, and just make sure they understand the risk that they're not only putting themselves at, but also their family members. So, and I ask, if you're not going to be vaccinated, or you're not going to, wear your mask, then isolate yourselves from your family members, because you want to protect them as much as possible. So,
And Dr. McLeod, you raised something interesting. Hold on one second, Dr. Kane, because it reminded me of a friend who recently told me that they lost a loved one because they had another family member who brought the virus home.
mhm.
And unfortunately, the elderly relative passed away, and they were mad. They were angry at the as they said, the irresponsible relative who brought the disease home, knowing that they lived that kind of lifestyle, and that the elderly family member was just being their kind-hearted self and allowing them to come and stay with them. But they were downright angry, and it just brought, as you were talking, I was remembering that particular scenario, and how do you just the whole anxiety amongst, or actually, as Dr. Kane has said, just the anger that people feel when a situation like that happens.
Well, that segues into, and I still want the family therapist to comment on the first part of that question. But it also segues into, well, what about the rights of the non-custodial parents when you have, that may be a divorce situation, a separation situation, where you have one of the parents. Their views on vaccination differ from those of the custodial parent. How do you address that in terms of family therapy? I would leave it up to one of the family therapists or counselors to also address that. Mr. Blair, are you available for that one?
Sorry, I kind of get muted, and then I think I am unmuted now. Well, somebody's controlling
Yes.
it. On the thing about the family members, I do have one or two family members who are adamant about not taking the shot. They have their worldview of what vaccines are and what they mean to our population of color, and so they're just not going to take a shot. And so again, it's at some point you just have to agree to disagree, and to just set your boundaries that we love you, but until this is over with, we will just love each other from a distance, and be okay with that. Because you can even see just in our general population that people are either all the way in or all the way out, and sometimes it doesn't matter what you say; they're just not going to change the way that they think about it. And the second part of your question was, did you want to?
It was just about the custodial rights and concerns of custodial versus non-custodial parent. I think it kind of answered that about agreeing to disagree.
Yeah.
Unless there's some legal issues that.
Yeah, that's a real legal question, and
Right.
that's really a tough one to address. But my guess would be, really speaking, the parent that had the custodial rights, if they didn't have if they also have the medical rights, then they're the ones that make the decision. So I think you'd have to look at the minute orders from the judge and see who has what rights, and
Got
then
it.
kind of
I,
make your best clinical decision.
Ms. Tahil, Ms. Tahil, I do want to at least address this one, at least my one. So, how does a family deal with the inability to participate in the care of the elderly parent or young child who is hospitalized and quarantined under life-threatening situation, i.e., intensive care? And then they would like to reach out to their loved one for comfort and, in some cases, explanations of ongoing life-threatening events. For example, the child who really doesn't understand what's going on, or the parent as they gotten older and their inability to understand. They may be suffering from some mental, such as dementia, may have some dementia-related issues. And then how do you deal with the sense of guilt and anxiety the parent and or caregiver of those individuals I just elaborated on? How do you deal with that, the guilt and anxiety that they may have?
I think, like, regardless of the situation, right, guilt and anxiety in terms of the treatment for that, I think it's, at least for me, the way I would approach it is to give the person space to feel that, and like anything else, is to hear their story and to acknowledge that there will be emotions, right, regardless, and to try to have them see what possible solutions they can come up with to alleviate the distress that they are feeling. So I would just encourage people to understand that these are different circumstances than normal. And we all have to just try our very best. And it's probably, we are undergoing, of course, the second wave, right, of the pandemic. It probably is not going to get better anytime soon. It is the new normal, and we will continue to have our life disrupted. So I think that to talk to the person about how universal this feeling is, and that it's really not a guilt that anyone should carry individually, it is the circumstances.
Anyone else that provides family counseling, especially? Or Dr. Samuels, if no one else is available. When you being in that hospital, and you may not encounter the clinical situation as much, but being in the hospital environment, some of those patients that because the loved ones can't come visit them, you provide mechanisms by which they can still communicate with their family.
Yeah, so I won't be able to speak as much to that aspect because I handle the employees more so, but I do know that there are opportunities where even the caregiver gives updates to the family, even if they can't physically be there to, when the providers are seeing the patient. So there are things that are in place to help alleviate that, as much as is.
Yeah, and Dr. Kane, we have a question from the audience to our guests before we end the show. In our office this week, we have had a lot of school-aged kids who are asked to quarantine by their school, and the only option is to do so with elderly grandparents because the parents, vaccinated or not, must work. Any suggestions for managing these real crises? Often there are very few options for working class families who may have no paid time off or alternative income. Anybody can answer to that? Can speak to that?
Well, this is where I highly encourage everyone who can to make sure that they are vaccinated prior to something like this happening, and still try to put in place those isolation techniques even in the home. It may even mean, letting the child have the main bedroom that has the bathroom in it, but making sure that they're going to go ahead and wear their masks even in the home, because you're right, there's just not always the option of the parent staying home with the child. And this is why vaccination is so highly encouraged. We have to protect those who cannot protect themselves. And right now, anyone under the age of 12 is not able to get the vaccine. So we have to protect them, and we have to protect ourselves and our elderly family members. But again, that just requires taking the time to educate.
Thank you, Dr. McLeod.
Anyone else?
So
go ahead, Johnny T.
I just wanted to get back to Dr. Samuel a moment, and anybody else can ask the question. I know that, we haven't talked a lot about it tonight, but I know for myself during the pandemic, actually before I started to really start focusing on my own health. But have you seen an influx of folks who are wanting to exercise more, or who are really trying to eat better, and those personal or individual wellness type activities? Have you noticed more folks that have a real interest in self-care, Dr. Samuel?
I can speak to that anecdotally from conversations we've had, with team members, just in general. But the amount of people that have purchased new exercise equipment for their home, or, have taken on, taking a walk in the morning or in the evenings, we have heard a lot more about that. When it comes to eating and diet, I think that might, in some degree, for some people, gone in the other direction. When we talk about the COVID 15 or COVID 20 or whatever that might be. I can even speak in my own office area that there are times that, there are a lot of treats brought in to kind of help with the mental health aspect of it. So I may not be as good about speaking about the diet part, but the exercise part, anecdotally, I have heard a lot of conversations where people are trying to do something because they can't go on vacations and those other things they would have done otherwise.
So my excuse for eating those cookies every night then is valid.
I won't go so far
No.
to say that. Maybe go for a walk instead of the cookies.
I love that. I love that going on the other side. Going just opposite of what you should be doing, which is still really watching your health and watching the blood pressure and watching the diabetes by watching what you put in your mouth, watching that elbow as it progresses moving towards your mouth.
But it certainly is a time, Dr. Kane, I'd like to add, though, on the serious tip, though, this I think, has been a time for families to really start to appreciate one another. When we were at a point of being on lockdown, a lot of families found themselves spending more time with the people who live in their household, and playing more family games, eating meals together. And I think those are valid things that we probably got away from. We were all so involved and engaged in the hustle and bustle of life, and many families have found that. And I'm certainly not the expert, but again, I've read a lot and saw on television where families have said that they really have reconnected with the persons who live in their house more. And some of our guests might be able to speak to that better, but definitely an opportunity to focus on self and your loved ones who live in your home.
Self and family. Okay, well, I know we're being respectful, as we usually are, being respectful of our panelists' time and our participants' time. I would like to, I'm going to turn it over to you, Ms. Turner. I just want to make this quick statement, and that is that we are yet to experience what the long-term consequences as it relates to mental, behavioral, and or neurological effects of COVID that we may see down the road. Is the new normal is what people say, or maybe the new normal is what people say, but the consequences of our children and those who have been infected with COVID and how it affects them mentally, both a physical afflictions, maybe in the brain, or and causing issues that like lead poisoning that you won't know until you get down the road, but also of the stress, of the loneliness, and the conflicts that people have encountered because of this virus, the intra-family conflict, the neighbor conflict, the friends that I've had people say that because their friend didn't get vaccinated, they cut them off. They don't want to talk to them anymore. So there's going to be a whole lot of long-term mental and behavioral issues that we will have to deal with, and especially those counselors and primary care providers. So with that, Ms. Turner, I'm going to turn it over to you to do our closing with the panelists and allowing them to make a statement, please, ma'am.
Thank you. And again, a good discussion. Sometimes talking about mental health in particular is not always the most popular topic that we want to talk about, but I think that hopefully you gain some insight tonight from tonight's discussion that it is important to acknowledge the feelings that each of us have and be honest with one another to say that it may be a point you need to seek professional help. And certainly from our guests, which you'll gain, you can find out more information about them on our website, pauseforthetruth.com. But before we close, I would like to ask each of our panel, and I'm going to do it differently this time. I'm going to start with the one gentleman on the panel and ask each of our panelists to give some closing remarks based on today's discussion and really leave a nugget with our audience on how to maintain mental and physical health during the pandemic. Mr. Blair, I'll start with you.
Wow. I would have liked to start it first. I would say during this time, I think we need to spend a lot of time checking in with ourselves, asking ourselves how we feel, how we're doing, what we're doing differently, so that we're in connection with ourselves. I think a lot of times what we do is we just kind of live life on life's terms, and we don't check in with ourselves, and that's how depression and anxiety sets in. So mainly, if nothing else, to take away from it is to just be more mindful of how you're doing, checking in with yourself, making sure that you're getting the sleep that you need, the exercise that you need, eating properly, picking up some hobbies. Just take care of yourself.
Thank you. Mr. Hill, how about you?
Yes, I would sum it up with, the self. So definitely self-care, self-compassion, and self-assessment.
Thank you. Dr. Samuel?
I think just remembering that you're not alone. Everybody is going through a difficult time at some point or another during this pandemic, and they've been affected in some way, shape, or form. So I agree with what everybody else has said, and just taking time for yourself, whether that means to take a break and do a hobby, exercise, connect with other people, just doing something that breaks you off from what your normal routine might be.
Dr. Samuel, I was waiting for you to say I can eat those cookies, but it just doesn't sound like you're going to squeeze that in.
No. I'm only promoting vaccinations and exercise.
Thank you. And last but not least, Dr. McLeod.
Yes, I agree. No increase in the cookies unless you're going, no increase at all. But yes, just agree with everyone else. And I also, want to say that sometimes just allowing yourself to do nothing is okay. We are so busy. We feel like we have to constantly be doing something, saving someone. We're doing a lot of education. We're doing a lot of talking to other people about why they should do what they should do, but being okay with sitting and having a moment of doing nothing sometimes, just to clear your mind. Again, take those mini vacations and just stay safe out there.
Amen to that, sister.
And even those staycations, as people say, I was joking with someone when I went on a beach trip living here in Florida where there are beaches everywhere. And I'm thinking, I laughed. I was like, why did I leave a beach town to go to another? But sometimes it's just a matter of getting away from your current environment. Thanks to all of our panelists tonight. I hope that our listeners have heard something again that will help not only themselves but that they could share with friends and loved ones. And Dr. Kane and our technology guru Tyrone Jackson, or as we say, called Tyrone.net, who's behind the scenes but has certainly done a great job with making sure that the technology part of our show runs smoothly. But we would like for you to please encourage your friends and family members to download the Podbean app and look for pauseforthetruth.com. If you have any questions that were not answered tonight, perhaps, send us a message at information@pauseforthetruth.com. And also, if you have any ideas or suggestions on future topics that you'd like for us to discuss, by all means, please share that with us again at information@pauseforthetruth.com. Look for us on Facebook. And the more we broadcast every Tuesday night at 6:30, hopefully and prayerfully our audience or fan base, as I'll say, will increase and you'll be able to access us easier and easier. We know now you have to download the Podbean app in order to look for us, or if you're on your iPad, you can also look for us or access it that way. But thank you all for listening. Thank you to our panelists. Dr. Kane, would you like to say some parting words with our listeners?
The only thing that I wanted to make mention would be that in the future we do have a plan on adding to our website information that or access to information for the listeners to be able to go to regarding whatever particular subject matter that we're discussing. So that is to come. Like you said earlier, we just jumped into it because the time it was there, and we feel we were much needed, or this type of approach is much needed, and we intend on staying as long as they would be polite enough to join us every Tuesday at 6. And with that, I'll say good night.
Good night, everyone, and thank you again for listening to Pause for the Truth.